Hi, I'm Patty Jolsom, one of the nurses here at Firm, and today I'm going to be instructing you on how to give a daily dose of Lupron. It comes in a kit. It's a Leuprolide Acetate kit. It says it's for 14 days, but there's enough in here for your entire cycle. Your physician, the nurse that you meet with, will give you specifics on day, what time of day to take it, and your actual dosage. You'll wash your hands first with, like you would with any injection. You'll need your Lupron kit, the medication that comes inside of it. You'll have alcohol, you'll have a gauze pad, and then the insulin syringe for one-time use. The Lupron comes, it's a multi-dose vial, should be nice and clear, no particles in it, and it can be kept at room temperature. It does not have to be refrigerated. What you'll do is you simply pop the cap off, and we'll go ahead and wipe it with alcohol. This is your one-time use insulin syringe, and there are multiple syringes in your box for use for each day. This syringe comes with a needle attached that will not, cannot be removed. And you'll pull down enough air in the syringe because we're going to displace air to put into the vial. Just makes it a whole lot easier to get your medicine out. And we'll pull back to a 10, but your dosage may be different and your nurse will let you know. You'll go right through the middle of the cap. It's got a little bullseye there. And we're going to put 10 units of air in. And invert it or turn it upside down, making sure the needle is in the fluid. And you're going to pull down to your dose. And if you have any air in the syringe, what you can do is actually pull down further and push it back in. Take it out. You've got your dosage. We'll just gently put the cap there so we can get ready for our subcutaneous injection. And you can refer to our video for that injection technique.
Today we're going to teach you how to mix and administer your Omnitrope injection. First, you're going to gather your materials. You'll need your 1 vial of 5.8 milligram powder, Omnitrope powder, and your 1.14 fluid diluent vial. You'll also alcohol need wipes, a 22 gauge 3 cc 22 gauge 1.5 syringe and needle, along with just to mix the medication.
Put that down and go back.
Your alcohol swab, an alcohol swab container. First thing you're going to do is remove the caps from the vials of medication. Next, you'll take your alcohol swab and clean off the tops of the vials. With your 3 milliliter 22 gauge 1.5 inch mixing needle, this is just a mixing needle. It's not intended for injection. You're going to put 1.14 milliliters of air and inject the air into the vial of diluent. And pull out all the fluid in that vial, 1.14 milliliters of the diluent. You may need to move your syringe down as far as you can go to get all of that fluid out. Once you've completed this, you'll take the needle out of the vial and put it into the powder. Swirl the mixture, do not shake. Pull your needle out and discard it into your sharps container. The next thing you're going to do is clean off the vial of Omnitrope mixed medication with your alcohol swab. Then you're going to pull your cap off, invert the bottle, inject the needle, and pull back till you get 53 units of medication. Once completed, carefully recap your needle and put the rest of your mixed medication into the refrigerator. You will have 2 doses of medication in each vial. Next, we're going to talk about subcutaneous injection. So with a subcutaneous injection, you're going to use your stomach. We prefer that you stay 1 inch away from your belly button due to the nerves around your belly button, but you can use either side. Again, take your alcohol swab and clean off the area of your stomach that you're going to inject the medication with. And let air dry. Pick up your injection needle with the medication in it in one hand, take the cap off, and hold like a pencil. Next, you're going to take the part of your stomach that you chose and cleaned off, pinch it, and inject the medication needle at a 45 to 90 degree angle. Once in, slowly inject the medication. Pull the needle out, and you can at that time unpinch your stomach. When completed, make sure you discard your needle in your sharps container.